interesting to see what happens there, and we'll know what happens if these sorts of decisions are made too soon. We'll be able to see exactly what happens in Quebec versus Ontario. And like from a data perspective and in the long term, that's actually a really useful thing for public health to know. Does this sort of school closure reopening make a difference in the population spread? And so, in future pandemics or future waves of this pandemic, it'll be really helpful to know what happened in Quebec versus Ontario over that time period. Is it something that, if the Quebec government had asked the London Middlesex Medical Officer of Health, which I'm quite sure they would never do, but if they did, it wouldn't have been the first places that we would recommend opening up. Again, school-age children, when you get to high school, kids are better able to manage those hygiene measures, but the younger kids, it's really difficult to get them to wash their hands, and good luck trying to get them to keep their distance. So we certainly would look to other places like parks and outdoor areas to open before going to schools.
All right. Thank you very much, Dr. Mackie. Dan Brown from the London Free Press has a question for you, Dr. Mackie. It's a pretty short one. How does it feel to be told by the Premier to, quote, pull up your socks?
Well, I mean, it's actually not much of a comfort to know that he wasn't talking to this health unit. Our numbers have been very good, and even in the provincial data sets, that is clear. But the most useful thing, and I think the Premier has been doing a lot of good work to make sure that the response across Ontario is guided by evidence, that he is working with the Chief Medical Officer of Health and other public health leaders at the provincial level. There's a lot that this government has done well. So, the fact that we may disagree on this sort of item, I'm not particularly fazed.
All right. Thank you very much. Now, a follow-up question from Dan Brown for you again, Dr. Mackie. The Premier has talked before the COVID-19 pandemic about making changes to health units in Ontario. But in the pandemic, an argument that the current system is working. That's what Dan is asking. I think sort of a comment there.
Well, I think that the data speaks for itself. The success of Ontario in the face of this pandemic has been far above many other jurisdictions around the world, and even quite compelling compared to other Canadian provinces. And so, very proud of the fact that we have been able to flatten the curve here, and that we are on the backside of this pandemic wave in this region. There is variation across the province. I mean, I mentioned in GTA, you still see higher numbers, in part because of the denser community there. But yeah, I think that, I had a great call this morning with colleagues across the Southwest, medical officers of health from the 7 health units in the Southwest region. And we went through, for example, in the long-term care home testing, how everyone's doing. Everyone is ahead of schedule. Everyone in this area will be done that testing before the deadline of May 15th. That was that is the provincial deadline. So from the perspective that everything that I can see, the system is working and it's working well.
All right. Thank you, Dr. Mackie. Sophia Rodriguez from CBC London has a question for you as well. Windsor's medical officer of health says he's struggling to get a consistent supply of swabs for testing. Is that a problem for London? Are there any challenges in getting a consistent supply of swabs? Additionally, is the region experiencing any significant delays or other challenges in getting test results?
So we were put on hold for our long-term care home testing from Friday until yesterday. We had a significant shortage here. We were already ahead of schedule, and we're still even ahead of schedule even more. Yesterday we had 1,500 or 2,000 swabs come in, so we're testing 4 more of the 11 homes that are outstanding in Middlesex and London today, and will be done by the weekend, and the request was for May 15th. So we're well on track. Yes, the swabs supply has been a bit hit or miss at times, but what we've done is prioritize the testing of people with symptoms in the assessment centers, in the hospitals. The labs have prioritize the lab capacity for those places. And so it hasn't had an impact on public health. It has slowed down our universal testing in long-term care, which is really testing of everyone that does not have symptoms. But again, the testing of people with symptoms is the priority, and that hasn't slowed down. We also had support from the government. MPP Jeff Urick reached out to see if there's any support we needed in getting adequate supplies. And at this point, there's been an additional major supply swab delivery yesterday in the province. So I think our supply chains are pretty strong right now. And the fact that we had to slow down on the testing of long-term care is, as much as it would have been great to be able to continue to charge forward that direction, we were able to maintain the health protection of the public by testing everyone that had symptoms in that period.
All right. The next question we're going to get into right now is from Casey Taylor, who I believe is joining us for the first time today. Casey is from Rogers Media and Easy 101 Radio. And Dr. Mackie, you were just talking about the testing and where the testing is done, and I think that's going to play into the answer to this question. The Premier was asked again today about not meeting testing targets and said people expect him to push public health units to get it done. I know you have said there's a disconnect between what's happening on the ground and what the province sees, or for that matter, when they see it. That said, I'm wondering if you can update us on the number of total tests the MLHU has done to date, and would you consider adding that information to the daily updates online, similar to how several other health units in the area have done?
Yeah, so I appreciate the question. What we can look at adding is a test being done in assessment centers, which is essentially general public in outside of the hospital. We have those numbers, we get them daily, and there's no trouble with sharing those. The last I looked at, the total number of the assessment centers was something in the 4,500 to 5,000 range, which is fantastic. The numbers in hospital, we don't have a clear picture, and that's not anything to do with the hospital. It's just that they're testing swabs from those 7 health units I mentioned across Western Ontario, and they're not necessarily assigning them to a specific health unit area. So it's somewhat difficult to pull that data out. The second problem is that you have testing now that is going through both the local public health lab, the hospital, and also the local public health lab. When they have more than they can test locally, they farm those tests out to the provincial public health lab or to private lab systems. And so once you get out that far, it's really hard to have a handle on the total number of tests that are being done each day. We have ballpark because we know that the hospital has been testing something like 200 people a day. The assessment centers, it's in the range of 150. It really has varied depending on how much interest there is in the public in getting tested. And then the third number is the long-term care home testing, and we know those numbers for sure. As of end of day yesterday, we had tested 1,567 people in long-term care across the region. There are something around 3,200 that includes staff and residents. And we'll be testing another between 400 and 600 today, depending on how quickly that is able to progress.
All right, Dr. Mackie, thank you. And I just had a quick follow-up to that. I know that there had been some discussion about testing possibly being done by EMS as well. Has that gone ahead? Is there testing being done in that sector as well? Yes.
So EMS, the paramedic services, have been a part of the assessment centers from fairly early on in that process. And the community paramedicine units, which have been the primary paramedics involved, can also and have also done some testing of people who are homebound, unable to leave their homes and do have symptoms of coronavirus. So EMS has been a great resource.
All right. Another question from Steve Young. Dr. Mackie, this one is for you. Have you had a chance to talk with the Premier over this? And by over this, I'm thinking Steve means the comments in the last couple of days.
Well, I mean, I haven't spoken with the Premier personally. He's got a lot of people to speak to these days. But, I have corresponded with some people in the Premier's office, just making sure that they have the same data that we have, and also to make sure that if there's anything that we can do to move things forward from their perspective, that we're more than willing and able to do so. So I would say the lines of communication are open. I also know that the Chief Medical Officer of Health for Ontario is constantly in contact with people from the Ministry of Health and other decision makers here. There's a command table that is being led by Ontario Health, and Public Health is right at the table, making sure that we have good decisions based on evidence.
Dr. Mackie, Sophia Rodriguez has asked a follow-up question to her question before about the swabs and whether we were experiencing any delays or other challenges in getting test results. Her follow-up question is, what is the time between swabbing for a test and getting results in Middlesex-London?
Okay, so turnaround times have varied considerably over the last few weeks. Essentially, prior to the push to test everyone in long-term care homes, turnaround times were in the range of 24 to 48 hours once the swab got to the lab. So there might be a delay in getting the swab to the lab if it was done, say overnight in a long-term care home. But once the swab got to the lab, 24 to 48 hours. We're now seeing that extend out to 5 days and sometimes more because the system is under pressure from those tests being done in long-term care homes. It's, again, prioritizing those tests for people that have symptoms. So the risk to the public of those relatively delayed turnaround times is low. But it has been a source of ongoing conversations with the long-term care homes, who of course would like to have their results as soon as possible.
All right. Another question from Sophia Rodriguez at CBC London. Mayor Holder, Dr. Mackie, this is for both of you. Mayor Holder, we'll start with your response to this question. Considering the amount of warnings bylaw officers issued over the weekend, are you confident Londoners will be able to abide to physical distancing rules once restrictions start to relax, as they will at the end of the week when garden centers and hardware stores reopen? So, Mayor Holder, we'll go to you first, and then Dr. Mackie afterwards.
Sure. Well, there will certainly be some obligation on behalf of the merchants to ensure that that the self-distancing that we have insisted upon is maintained. I think that's in the same respect, though. What I have seen in stores, grocery stores, for example, when I've gone into them, is that the spacing, for example, during checkout is clearly marked. People are being exceptionally mindful of the distance needed. You see in grocery stores a number of people wearing masks as well. But I would tell you that while we put onus on the merchants to ensure that people have kept their distance, my sense is people are not going to take this for granted. I think the fact that we only had one individual charged in the weekend in terms of an absolute bylaw infraction says to me that the warning for the balance of them was sufficient purpose. So I would think that we will have pretty good compliance as we work through the pandemic. I'm somewhat nervous, though, as it relates to Mother's Day coming up, because what does that mean? People want to go see mom, and I get it, but we're stay home. That's what we're saying. Stay home, make the Zoom call, make the phone call, tell them you love them, but stay home.
Dr. Mackie.
Well, I mean, from the point of view of public health, we're constantly trying to support good behavior, and we know that those engineering controls are always more effective than the controls that rely on people to make decisions. And so yes, it is more effective to keep a store closed than to allow people in, where they have to make good decisions each step around the facility. And also, there comes a time where there's a balance where the people's rights and freedom become more important than what is a risk that is really dropping now. So we're not quite at that point. I think we will be at that point soon. And I think the timeline of opening up those facilities is appropriate. You've also got a real change in culture, and I think this is what the mayor was referring to around grocery stores, right? Where people in this area now understand the value of physical distancing, and you'll get a similar sort of reaction in those hardware stores and garden centers where people are doing their best to keep apart. That's certainly what I'm seeing in grocery stores. I think also grocery stores have been great leaders in terms of making sure that they have adequate staff on hand, making sure that they have sneeze guards for their checkout staff, all sorts of innovations, the tape on the floor to keep us apart in our lineups. These are things that we will be asking garden stores and hardware stores to do as well, because they are proving to be an effective part of the puzzle.
All right. Thank you, Dr. Mackie. Thank you, Mayor Holder. And that brings to a close not only the list of questions, but also our time for today. I want to thank you both for your time and for the information you've shared. And we look forward to seeing you again tomorrow on Thursday at 2 p.m. for our next virtual media briefing. Have a great rest of the day.